be raised. Would you like to make a motion?
Yeah, there's no motion really needed, but if you look through 1 through 4, we'd just like to move those forward with a voice vote.
Great. Any opposed to a voice vote on 1 through 4 under concepts to be raised?
Excuse me, 1 through 5.
1 through 5. All right, all those in favor to raise 1 through 5? Oh, is there a motion?
Just moving forward.
Yeah, you need a motion.
Motion to raise items number 1 through 5.
So moved.
All those in favor signify by saying aye. Aye.
Aye.
Any opposed?
Aye.
Any abstentions? All right, the ayes have it. 1 through 5 have been moved forward. Moving on to number 6, an act concerning the elderly nutrition program. Do I have a motion?
So moved.
Is there a second?
Recusal. Second. Representative Davis.
Moved by Senator Lesser, seconded by Representative Hughes. Any discussion? Yes, Representative Case.
I will try. Losing a voice doesn't help. There were some questions on, we passed a bill last year regarding this. There's no language behind it. Can somebody please fill us in on where it is?
Senator Lesser.
Yes, I thank you, Madam Chair, and through you to the honorable ranking member. This was a request that we got late in the game from the community action agencies. The language right here is a study bill, a study of the elderly nutrition programs. It's our understanding that we're going to have a conversation with the agencies moving forward on a bipartisan basis to understand what it is that they are looking for through you.
Representative Case, are you all set? Okay. Representative Mastro Francesco.
Thank you. Thank you, Madam Chair. So as Representative Case mentioned that there was a similar bill last year. Is the language going to be very similar to the bill from last year with maybe some changes and modifications? And would you know what the bill number was from last time? Through you.
I do not know the bill number from last time. What I do know about what's being proposed this year, and I wasn't on the committee last year, so I don't know how different it is, but the proposal this year is a task force. Was that the case last year as well?
I don't know if it was a task force last year. We seem to pass a lot of task force, so I would think that if it was, it's possible.
What we are hearing is that there's just been an increase in utilization, and so we really need to look at this program to ensure that the elderly continue to get the services they need.
Thank you. And then through you, you had mentioned that this was an agency bill, not one of our agencies. It's, you said it's a committee.
So numbers 1 through 5 for agency, 2 through 5 were agency bills. Number 6 is not an agency bill. This came to us through some advocates who expressed a need in the community.
Okay. Thank you, Madam Chair.
You're welcome. Representative Case.
I will try this. So last year we passed a bill and it was for the elderly nutrition program so that we could go out and find out more information of what was going on as we were delivering meals and to bring that information back. So I'm willing to hear this to see where there are more problems, but I'd like for us to find out what we learned from last year's bill.
Agreed. I think that'd be very important. Thank you. Yes, Representative Buckby.
Thank you, Madam Chair. I just would like to hear Representative Case speak more in length about that, if you would, please. Through you, Madam Chair.
Representative Case. All right, Senator Lesser.
Yes, through you. I've got a whole list of questions for Representative Case. I was gonna be here all morning. No, I'm kidding.
All right, any further discussion? If not, can we have a voice vote? All right. All those in favor of an act concerning the elderly nutrition program, please signify by saying aye.
Aye. Aye. Aye.
Any opposed? Any abstentions? All right, number 6 passes. Moving on to section 4 of the agenda, proposed bills to be considered for a straight change of reference. Number 1, House Bill 5764, an act concerning communication access for deaf, hard of hearing, and deafblind persons in healthcare settings. This is a change to public health.
So moved.
Is there a second?
Second.
Moved by Senator Lesser, seconded by Representative Comey. Any discussion?
I would just say thank you,
Yes, Senator.
Madam Chair. I would just say thank you so much. This is actually a bill I proposed about access to quality communication in healthcare settings. So I think that this is an appropriate referral to the Public Health Committee. And although I would love for it to be heard here as I sit on this committee, but I will look to see it brought up in the public health. Thank you so much.
Thank you, Representative Comey. Senator Lesser. Oh, nope, he's all set. Any other discussion? All right. All those in favor of change of reference to House Bill 5764, please signify by saying aye.
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 Any opposed? Any abstentions? All right, the motion passes. Moving on to section 5, vote to take final action. Number 1, Senate Bill 82, an act eliminating income and asset limits for the MedConnect health insurance program for working persons with disabilities. This is a JFS to the floor. Do I have a motion?
Second.
So moved, Representative Dayton.
So moved by Senator Lesser and seconded by Representative Fortier. Any discussion? Representative Master Francesco.
Thank you. Thank you, Madam Chair. I'll save Representative Case from speaking for a few minutes. A couple questions on this bill, if I may. Is this particular bill is removing all of the asset limits? Is that correct? Currently, if I'm not mistaken, is the asset limit on 10th is it 10,000 for unmarried and 15,000 for married? And when they talk about asset limits, can you explain to me or the public what you mean by an asset limit? What is entailed? What's considered an asset through you?
Senator Lesser.
Yes, thank you, Madam Chair, and through you to the honorable representative. An asset under the terms of the MedConnect program, I believe, is anything other than a retirement account that the person possesses.
So would that be, it's anything other than a retirement account? So their home is considered an asset?
I believe so, through you.
Okay. And currently, right now, as I mentioned, the limit is 10,000 and 15,000 for married. My concern is that there's no ceiling, right? There's no limit at all. There's no asset limit. Certainly, there's people out there that certainly need the help. But this is no limit at all. So I'm assuming when it comes to work requirements too, this program is more for people with a disability that are able to work, correct? Is that correct for you?
That is correct.
And is there an income requirement, a cap on the income they could make?
Senator Lesser.
Yes, thank you, Madam Chair. And through you to the representative, this bill would remove the income limit, but I would say that the requirement under federal law is that DSS charge a premium adequate to cover their costs. So there is a sliding scale premium based on people's ability to pay. So the state is not subsidizing a wealthy person for this.
Thank you. And through you, so the income limit is being removed and the asset limit. You did say income limit, is that correct?
That is correct.
So currently, right now, under this particular program, can you tell me what is the cost sharing that somebody would pay for the insurance?
Senator Lesser.
Through you, there's no cost sharing. There is a premium that is charged.
That's what I mean by cost sharing. I'm sorry. There's a premium. What is the premium right now that they're charged? Is there a scale that you can tell me what they're paying?
Would actually ask if a representative from OLR is able to speak to that.
Maybe it's best to continue with your questioning and we'll answer it when we find it.
Thank you. So I'm understanding this correctly. People with a disability, is there a definition? Because you're obviously able to work if you have some people are able to work. They're not severely disabled, but fortunately they can work. is there a definition of what they consider disability? Like what type of disability through you?
Yes, I believe that is defined in order to be eligible for this program.
Thank you. Can you point that out to me?
Well,
What, I'm just curious, where, is it in the statute? Is it? It would, the types, I guess the types, because there's many people that are on disability for major reasons. Some things are maybe, maybe not as severe and not as bad. So I'm just curious as what the definition of disability is. What, like carpal tunnel, for example, there's people with a disability, they have carpal tunnel, but they're still able to work. Is that one of the disabilities, I would say, that, that would qualify?
So the department would do a disability determination. I don't have that available for you right here.
Okay. And is a disability, you'd have to file that with the government, under Social Security? Or is it a disability through the state?
Senator Lesser.
Thank you, Madam Chair, and through you, you can qualify for the MedConnect program through disability determination by qualifying for Social Security disability insurance or supplemental security income. You can also have an internal disability review by the Department of Social Services through you.
Thank you. And when you said an internal disability, can you elaborate on that a little bit? I'm just curious what it.
Yes, the Department of Social Services is able to make a disability determination internally.
Okay, I get it. I get it. So it's not necessarily they have to go through the Department of Social Security for disability. It could be somebody bypassing that and maybe just going through the DSS in Connecticut to determine if there is a qualifying disability. Is that correct? Through you.
Through the chair, yes, that you can have a determination through the Department of Social Services.
Thank you. And through you, Madam Chair, how many people right now are participating in this program? Would you know that?
We can turn to OLR.
So current MedConnect participants are somewhere in the ballpark of 3,000 in the state. And back to your premium question, the premiums for MedConnect. So if the countable income is below 200% of the federal poverty level, there's no premium. But if countable income is above 200% of FPL, the premium cost is based on 10% of the income above the limit. So that is from DSS's website. The actual amount of the premium is not specified in statute.
Thank you for that. Can you just go back to, if it was above, it would be 10% of, can you repeat that for me?
The premium cost is based on 10% of the income above that limit. So for the household, if their income exceeds 200% of the FPL, the premium cost is based on 10% of that difference.
So if somebody was making like $100,000 a year and they were working or $50,000 a year, $40,000 of that is.
The language just says based on, so it's not a specific formula.
Okay. Thank you. And thank you. I appreciate OLR. Thank God they're here. One more question. Do we know, she had just mentioned that about 3,000 people are on this program right now. By doing away with the asset limit and the income limit, do we know how many more people are projected to be on this program? For you?
Yeah, not at this point, but if passed out of committee, we'll be able to get a fiscal note and we'll have a better understanding from the Office of Fiscal Analysis.
Okay, thank you. Yeah, my concern is that obviously anybody with disability, I'm all for helping. Those are people that truly need it. But there's no asset limit and no income limit. And people with a disability, they're still hopefully able to do some sort of work. The sky's the limit on how much money they can make. And that's really a concern of mine. So thank you. Those are my concerns. I appreciate you answering my questions. Thank you.
Yes, thank you. Senator Lesser.
Thank you, Madam Chair. We're still figuring out the sharing of the mic issue. Just in response, I take the gentlelady's comments seriously. The testimony that we heard was that by having an income and asset limit, what we were doing was discouraging people who have disabilities from fully participating in the workforce. They were choosing to take less well-paying careers in order to keep their benefits. And so the intent of this program pay taxes and to be as involved as they are able to. So they saw that the income and asset tests were really limits on working people with disabilities, and it's our intent to try to reduce that and promote a full inclusion of people with disabilities in the workforce.
Representative Hughes, are you all set?
That's exactly what I was going to say. Thank you, Madam Chair, is that because these are folks that rely on durable medical equipment, people with cerebral palsy, people with muscular dystrophy that really, really rely on their, wheelchairs and so forth. They cannot afford to lose their MedConnect insurance because it is life-saving. So, but these are folks that want to expand their business. They want to, start a business, be a CEO, but they need this insurance to live. So our asset limits and income limits are certainly holding them back from providing the services that they're so talented and qualified for. Thanks.
Thank you, Representative Hughes. Representative Case.
I'm gonna try. So if you have an inheritance, is that included as no asset?
Senator Lesser.
I believe, and I'm happy to be corrected by one of our excellent nonpartisan staff, that an inheritance would be included unless it were put in a retirement account as provided for. I don't know if there's a way to do that through a clever elder law attorney, but
There's no asset limit.
oh, you're asking me I thought you were talking about under current law. No, this would allow people, regardless of assets or income, to participate. But again, they would be charged a premium under the formula that LCO or OLR outlined earlier.
If you won $1 million in the lottery, is that asset? These are questions that came in appropriations a couple years ago.
If you won $1 million in a lottery, you would have $1 million of income. And that would be 10, as I understood it, that you would have to pay 10% of your income above 200% of poverty. So that would be a pretty hefty premium right there.
So to say that there's no asset limit, we're almost saying there is. Because if you're reaching that, you're paying a certain amount of what you have in the bank.
So the premium, yeah, there is a sliding scale premium that's pretty aggressive. So the answer is yes, you would pay a premium based on your income. It may not be in everyone's interest to participate in the program who qualifies, because you may be able to get health insurance through another means it's more affordable.
Okay, let me let somebody else.
Representative Master Francesco.
I'm sorry. Thank you for the second time. Representative Hughes just kind of got me thinking a little bit. I was just curious. So right now we know that there's 3,000 people on this program right now. Do we know how many, maybe this is a question for OLR, how many people apply each year for this program through you?
That would be information we would seek from the department if you'd like us to ask.
Thank you. And I would also be curious to see how many people have been denied for this program.
OLR is shaking their
From
head. They can
OLR.
look that up as well.
Is that something you can
Thank
get me
you.
that information on? And then going back to Representative Case's question that he brought up, if you won the lottery, we all love to do that. You Senator Lesser, you had mentioned that it's based 10% above your asset limits, right? Your income. Did you mention something like that, that you would have to pay a hefty premium? I mean, there is a max of what an insurance, what a premium would cost, right? Maybe it's $500 a month or $1,000 a month, but there is a maximum amount. So somebody say winning the lottery, let's just say, and I don't know what the total dollars are of the cost of the insurance, or I call it the cost sharing or the premium on it. I don't know how significant that total is. Would you be able to elaborate on that a little bit? No, I'm sorry. I'm just trying to make the case that if somebody here is very wealthy, I don't know what kind of disability they have. We're removing the asset limit on them, and we're removing the income limit. And there's people out there that truly need this service that can't get it.
I would just respond that this the intent of this bill is to address the concerns we heard at the public hearing, where that folks who are in need of this are struggling because they are unable to work to their full capacity because of these limits. And so by removing these limitations, we're actually supporting the very people who need the program.
And I agree with that. Thank you for that. My point is that there are people that maybe they don't have a disability and don't even have income requirements. They could, and that they can't even afford to have insurance, whether it's through the state or anything else. And that was my point on that.
Is there any objection? No
Sorry.
objection.
Anyway, my point is that obviously we need to help people that need it. But there are people out there that are fortunate enough not to have a disability. They are struggling. They can't make ends meet and they can't even afford insurance. And, you know, we're removing an asset limit and an income limit. So it's a good possibility that, yes, you want to get more people into the workforce and maybe they don't work because they're making a certain amount of money and they don't want to hit that. They don't want to go over that just a little bit, but is the sky is the limit. You know what I mean? It's endless. So that's really a concern I have on this and the cost factor. Thank you, Madam Chair.
Thank you. Representative Comey.
Thank you so much, Madam Chair. You know, one of the testimonies that we heard was from a constituent of mine, and she was pursuing her master's in social work and was doing some clinical hours for Connecticut Disability Organization, and you know, understands the struggles that the disabled have, and you know, wants to provide the mental health support for this community. And one of the other things that she pointed out was that she could never own a business and continue to work, you know, additional hours and expand and serve the community because of the limitations under Medicaid for the working disabled. And one of Medicaid's goals is to allow members independence and be able to take care of themselves whenever possible. And I think part of our focus in this committee should be making sure that we do what we can to, you know, to allow folks who may be dependent on the Medicaid coverage to get, you know, their durable goods, as Representative Hughes mentioned, and make sure that we get as many people out in the workforce as possible. So I'm looking forward to supporting this bill. Thank you, Madam Chair.
Thank you, Representative. Senator Seminara.
Yes, I remember the testimony that you're referring to, and I also have a child with a disability, so I who is working at this point. So I really do understand the struggle. The issue that faces us, though, is that if you're removing an asset limit and you're removing an income limit, the sky is the limit. Now, I would like to think that if people with disabilities get to the point where they are self-supporting themselves or they have options for other insurance, that they would take them. And I would like to believe that that would happen. And I think for the most part that would happen. But if you remove everything, there are going to be some who may take advantage of that and then make it more difficult for the people who really need it. Every other program that we have here, we have limits. So why do we have to make this limit less? That's my point. Thank you. Thank you for the time. Thank you.
Thank you, Senator. Any other questions or comments? All right. If not, I would ask the clerk to call the roll.
Representative Gilchrist,
Yes.
Senator Lesser,
Yes.
Senator Seminara,
No.
Representative Case, no.
Senator Gaston,
Senator Gaston, yes.
Representative Dathan,
Representative Dathan votes yes.
Senator Marr,
Senator Marr votes yes.
Representative Butler,
Representative Butler votes yes.
Representative Cook,
Representative Cook votes yes.
Representative Comey,
Representative Comey votes yes.
Representative Exum, Representative Fortier,
Representative Fortier votes yes.
Representative Hughes,
Representative Hughes votes yes.
Representative Johnson,
Representative Johnson votes yes.
Representative Kit,
Representative Kit votes yes.
Representative Leeper,
Representative Leeper votes yes.
Representative Santiago,
Santiago votes yes.
Representative Buckby,
No.
Representative Ferraro, Representative Mastro Francesco,
Representative Mastro Francesco votes no.
Representative Pizzuto,
Without income and asset limits, Representative Pizzuto votes no.
Representative Paletta.
All right, the votes will be held open until 11, at which time we will begin a public hearing. With that, going to the final item on the agenda, under number 5. Number 2, Senate Bill 58, an act concerning conservator compensation by Medicaid applicants and recipients. Do I have a motion?
So moved to move for voice vote.
Is there a second? Okay, we don't need it. All right. Any discussion? All right, hearing none. All those in favor? Oh, you did ask for roll call? You just said voice.
Aye.
Oh, we have to do.
Representative
We have to do a roll call because it's a JFS to the floor.
Representative DiCaprio.
Okay. So let's start again. Do I have a motion to JFS number Senate Bill 58 to the floor?
So moved.
Is there a second? Second. Moved by Representative Case, seconded by Senator Seminara. Any discussion? All right, seeing none, will the clerk please call the roll?
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Lesser,
Yes.
Senator Seminara,
Yes.
Representative Case,
Yes.
Senator Gaston,
Yes.
Representative Dathan,
Representative Dathan votes yes.
Senator Marr,
Senator Marr votes yes.
Representative Butler,
Representative Butler votes yes.
Representative Cook,
Representative Cook votes yes.
Representative Comey,
Representative Comey votes yes.
Representative Exum, Representative Fortier,
Representative Fortier votes yes.
Representative Hughes,
Representative Hughes votes yes.
Representative Johnson,
Representative Johnson votes yes.
Representative Kit,
Representative Kit votes yes.
Representative Leeper,
Representative Leeper votes yes.
Representative Santiago,
Santiago votes yes.
Representative Buckby,
Yes.
Representative Ferraro, Representative Mastro Francesco,
Yes.
Representative Pizzuto,
Representative Pizzuto votes yes.
Representative Paletta.
Okay, as a final reminder, the votes will be held open till 11. Our next meeting is right after this, at 11 o'clock in room 2C. We have a public hearing. And with that, we'll go into recess. Oh, good question. I think she sent an email to that effect. Votes are being held here and on Zoom.
Hi, this is Rev Johnson. Could you tell me the votes that I missed?
Representative Porter votes in the affirmative.
Representative Osborne.
Representative Osborne votes in the affirmative.
Representative Reyes.
Representative Reyes in the affirmative.
Representative Representative Rosario.
Representative Rosario votes also in the affirmative.
Representative Chandra.
Hello.
Yeah, I'm looking for the clerk, Susan.
Oh, so am I. Yes. I'm sorry.
Representative Johnson, hang up, please.
I'm sorry. What room are you in?
Votes will be left open until 2 p.m. Madam Administrator, what do we have going on later today and the rest of this week?
Representative Johnson, were you able to, were you here for the voice votes at the beginning?
No, I was not.
Okay, so we did a voice vote on bill concepts 1 through 5. 1 through 5, can you hear me? I'm sorry.
I don't keep the numbers in my mind.
Welcome. Thank you. I'm sorry, can you say that one more time?
What did you say? I don't know what concept 135 is. I don't have it in front of me.
Okay, it's an act concerning a passive Medicaid redetermined process for certain age, blind, or disabled recipients, an act concerning mandated reporters, an act concerning various revisions to the Department of Social Services statutes, an act concerning excess nursing homes beds and payment for non-patient care in nursing homes, an act concerning Medicaid reimbursements to community living arrangements, intermediate care facilities for individuals with intellectual disabilities, residential care homes, and nursing facilities.
Okay, yes, to all of those. Thank you so much. I'm sorry.
Then the next concept was an act concerning the elderly nutrition program.
Yes.
And then straight change of reference for proposed bill HB number 5764, an act concerning communication access for deaf, hard of hearing, deaf-blind persons in healthcare settings. Straight change of reference to public health.
Final comment?
Yes, I agree. Thank you.
Great. And then you were here for the 2 votes at the end, right? So
Yes, I was.
You can
Sorry.
be on-
Meetings at once.
Wonderful. Thanks so much.
Thank you. See you a little bit.
See you in a
Bye-bye.
little bit. Senator Marr,
Senator Berthel. Yes, thank you.
were you here for the voice votes?
I was not, but I voted the affirmative.
Wonderful. I'll make a note of that. So it was a voice vote for concepts 1 through 5, voice vote for concept number 6, and a voice vote for the straight change of reference.
Yes.
All right. Thank you so much.
All right, thank you. Take
See you in
care.
a little
Bye.
bit. Bye-bye.
Yeah.
Hello, Representative Ferrara. How are you?
Good, how are you?
Good. All right. So let's go through these concepts. So we have a voice vote for concepts number 1 through 5. How do you vote?
Aye.
Great. Voice vote for concept number 6, an act concerning elderly nutrition program.
Were there any no votes on that?
It was a voice vote.
Okay, aye.
Wonderful. And again, a voice vote on straight change of reference to public health.
Aye.
It was HB 5764.
What was that?
It was HB 5764, straight change of reference to public health.
Okay, yes.
Aye, great. And then for SB 82, which is an act eliminating income and asset limits for the MedConnect health insurance program for working persons with disabilities. How do you vote for that?
And were there any no's on that?
Yes.
Could you tell me who they were?
Straight down. So Senator Seminara, Representative Case, Representative Buckby, Representative Master Francesco, Representative Pizzuto voted no.
They were all no? Okay, I'll take a no too.
Okay, and last but not least, SB 58, an act concerning conservator compensation by Medicaid applicants and recipients. Everybody voted yes.
And I'll be a yes as well.
Wonderful. And you're all set.
Thank you. You have a
Thank you.
wonderful day.
You too. Take care.
Yep, bye-bye.
Bye-bye. Hi, Representative.
Hi, good morning.
How are you?
How are you?
I'm good. Happy Valentine's Day.
Happy Valentine's Day.
All right, let's hop into this. So we did a voice vote on concepts number 1 through 5. How do you
Okay.
do that?
Representative Exum votes yes.
Great. And then we did a voice vote on concept number 6 and concerning the elderly nutrition program.
Representative Exum votes yes.
Wonderful. Then we did a voice vote on HB 5764. It's a straight change of reference to public health.
Representative Exum votes yes.
Great. And then we did a vote to take final action on SB 82, an act eliminating income and asset limits for the MedConnect health insurance program for working persons with disabilities.
Representative Exum votes yes.
You. And last but not least, SB 58, an act concerning conservator compensation by Medicaid applicants and recipients. How do you vote?
Representative Exum votes yes.
Amazing. That was easy. Yeah.
Thank you so much. Have a great day.
You too.
Thank you.
Bye.
Bye-bye.